Men are always perceived as dominant and masculine, and to enter a feminine profession seems to be unusual. Good day, fellow researchers and audiences. We are the BSM3G Group 4B students presenting to you our research paper entitled Factors Influencing Male Students in Entering the Nursing Program. Together with me in this study are Wendy Rodriguez, Gerobelle Salinas, Kianna Loise Salvo, and yours truly, Kianna Soteo.
Purpose of the study. The research study aimed to determine the factors influencing male students in entering the nursing program. The study was able to determine the factors influencing male students in entering the nursing program. Specifically, the study was able to answer the following questions. 1. What is the demographic profile of the participants based on age, year level, senior high general weighted average, area of residence, and family income? 2. What are the factors influencing male students in entering the nursing program? 3. Is there a significant relationship between the factors influencing male students in entering the nursing program and the following demographic profile variables? Age, year level, senior high, general weighted average, area of residence, and family income.
This study is a quantitative descriptive research design that employs survey method while utilizing a researcher-made instrument was used. Descriptive research design was used to describe the different factors that affects the decision of male students in choosing nursing. The participants of this study were the 142 male level 1 to 4 nursing students of a local university in Bacolod City enrolled in the second semester of the academic year 2022 to 2023. In determining the sample size, we used the Slovin's formula and stratified random sampling was utilized to draw a subsample size for each year level, followed with simple random sampling by the wheel of names was used to select the participants in each year level. The study utilized a researcher-made questionnaire with a modified Likert scaling instrument. Questionnaire has two parts, the demographic profile and the factors influencing male students in entering the nursing program. The instrument's mean score during the validation was 4.97, which was interpreted as excellent and considered as validated. And for the reliability, the instrument scored a 0.835, which was interpreted as reliable and accepted.
For the results and discussion, the demographic profile of male nursing students revealed that the majority of the participants are in the age range of 22 to 41 years old, comprising 74.6% of the sample. Secondly, in terms of the year level, level 4 has the highest representation of 33.8%. In terms of the area of residence, the majority of the participants, or 58.5%, live within Bacolod City, while the remaining 41.5% live outside the Bacolod City. Lastly, when considering family income, a significant proportion of male student nurses, or 66.9%, belong to the middle class, followed by the high class, low class, and poor. Moving on to the factors influencing male students in entering the nursing program, the factors of the study were divided into 7 categories, which include personality, influence, role strain, appearance and reputation, rewarding career, flexibility of the course, and global nurse shortage. From each category, the top 3 statements with the highest need were identified as the primary factors why male students enter the nursing program. For the first category, which is personality, it showed that most male nursing students love helping others with a mean score of 3.59 and interpreted as strongly agree, followed by being compassionate for people garnering a mean score of 3.51 and an interpretation of strongly agree. Lastly, being patient and empathetic to other people has a mean score of 3.38 and an interpretation of agree. Nursing provides a direct opportunity to assist those in need, relieve suffering, and contribute to the well-being of individuals and communities. This implies that male students with natural empathy and compassion for others may be driven to nursing as a job where they may provide comprehensive care and assistance. The second category, which is influence, it revealed that most males believe that their parents and relatives know what is best for them. This had a mean score of 2.65 and an interpretation of agree, followed by choosing nursing because most of their relatives are already nurses, with a mean score of 2.64 and interpreted as disagree. Lastly, they pursued nursing because their parents said so, with a mean score of 2.32 and an interpretation of disagree. This implies that while many of the participants had not initially considered nursing as a career option, the support and encouragement they received from family, friends, and acquaintances, particularly those who were already in the profession, had a positive impact on their vocational aspirations and career choices. The third category, which is role strain, shows that most male students think that gender roles should be eliminated in the medical field. This has a mean score of 3.73 and an interpretation of strongly agree. Next, they suppose that being in a feminine profession doesn't affect their masculinity. This garnered a mean score of 3.71 and an interpretation of strongly agree. Lastly, they presume that men can also provide care for the patient which had a mean score of 3.65 and an interpretation of strongly agree. Male nursing students are questioning gender preconceptions and established gender norms in the nursing industry. Instead, they enroll in nursing school because they see the necessity of breaking down gender stereotypes and feel that being born as a man or woman should not limit one's skill. For the fourth category, which is appearance and reputation, it showed that male students think that nursing is a respected profession. This had a mean score of 3.73 and an interpretation of strongly agree. Second, they're also convinced that nurses are regarded as honest and caring by the public, which garnered a mean score of 3.63 and interpreted as strongly agree. Lastly, with a mean score of 3.55 and an interpretation of strongly agree, most male students think that the white uniform is attractive. This implies that the established reputation, education, and appearance of the nursing students conveys professionalism and may help to the view of nurses as intelligent and trustworthy individuals. The fifth category, which is rewarding career, shows how male students feel satisfied whenever they help people. This got a mean score of 3.73 and an interpretation of strongly agree. Followed by a sense of fulfillment whenever they can apply what they learned, this had a mean score of 3.71 and an interpretation of strongly agree. Lastly, with a mean score of 3.65 and an interpretation of strongly agree, male students also want to make a difference in their own way. Many find it rewarding to be able to directly touch people's well-being and contribute to their health and recovery. It demonstrates their sensitivity, compassion, and desire to help others in need. The sense of accomplishment that comes from utilizing their newly acquired information and skills is also significant. Moving on to the sixth category, which is the flexibility of the course, most male students are aware that there are other options aside from being a hospital nurse. This had a mean score of 3.73 and an interpretation of strongly agree, followed by believing that nursing offers a wide range of career paths with a mean score of 3.63 and an interpretation of strongly agree. Lastly, with a mean score of 3.55 and an interpretation of strongly agree, they are convinced that nursing is a high-paying profession, especially abroad. This showed how the awareness of other work opportunities influences male students' decision to pursue a nursing degree. This information broadens their perception of the nursing profession's possibilities, making it an appealing option. Lastly, the global nurse shortage. The results reveal that male students are aware that there is a shortage of nurses around the world. This had a mean score of 3.72 and an interpretation of strongly agree. Next, they chose nursing because of the varied job opportunities, which garnered a mean score of 3.66 and an interpretation of strongly agree. Lastly, with an interpretation of strongly agree and a mean score of 3.62, most male students believe that there is a need of men in the workforce. This understanding of the shortage encourages male students to consider nursing as a career path, knowing that their talents will be recognized and that they will be able to communicate to meeting the healthcare requirements of their communities. The 7 factors identified in the study provided valuable insights in influencing male students in entering the nursing program. These factors include personality, influence, role strain, appearance and reputation, rewarding career, flexibility of the course, and global nurse shortage. It implies that despite the stigma surrounding male nursing students, these factors arise as indicators of their motivation to pursue a traditionally female-dominated profession. The results also show that there is no significant relationship between the factors influencing male students in entering the nursing program. It may further imply that the demographic profile of male nursing students may not influence the factors influencing them to enter the nursing program.
Now we move forward to the recommendations of the study. University administrators develop and promote gender-sensitive curriculum, ensuring gender diversity and setting minimum standards on gender sensitivity in the curriculum. Provide orientation and talk on gender sensitivity to educate staff, teachers, and students on the negative effects of gender stereotyping. Nurse educators to provide guidance, influence, and supervision to male students throughout the classroom and clinical setting. Provide tutoring, academic advising, career guidance, coaching, and study groups. For nursing students, acknowledge the existence of gender bias in the program and identify coping strategies on how to deal with it, such as skills in dealing with negative feedback, stress management, and maintaining an optimistic mindset. For parents, provide moral, emotional, and financial support to the children. And lastly, for future researchers, further develop, re-examine, and elaborate on the theory and framework that the study was anchored to and address the limitations of the study.
So that would be all for our study. Thank you so much for listening. For our references, you may scan on the QR code provided. Thank you.